Chinese medicine is not an attacking system. When I first started studying Chinese medicine, I was really enthralled by the ideas and the concepts that it's about. And there's some things that like are principles and basic foundational understandings, and then as you start getting into practice, and through the course of practicing, I guess, in the style that you choose, some of those things just weren't at the forefront of my practice. It wasn't mean that they were dismissed, they just weren't at the forefront, and maybe just misunderstood or not understood at all. Through the years of practice, so I've been doing this for like 18 years now, I've always been searching for better ways to do things, just in business, in the practice, in all those sort of things. And that's what made me come across the course that I studied a few years ago. I started a journey of studying classical Chinese medicine. So how that makes it different to standard Chinese medicine, you'll hear that as we go along in this video. The general understanding of medicine, which this kind of goes against in a way, and I don't know, this is just in our heads as a Westerner, as a person that grew up in Australia with that Western framework, so this would be common in the US, UK, that kind of thing, that medicine, in order for it to be effective, it should be attacking something. It should be attacking disease. It should be getting rid of disease. Now, yeah, we want to get rid of disease. We want to get rid of disharmony in the body. We want to get rid of illness. But there's it's just in the language. It's just in the thing that we need to put something into our bodies in order to fight the illness, rather than looking at, well, why isn't our body in itself fighting the illness? Why isn't our body actually attacking the illness? Why isn't our body doing something about that? And in most times it is doing something, but it's not doing enough. Otherwise that person wouldn't be, for me as a practitioner, they wouldn't be there as a patient to me. So you may be watching this and you're thinking, yeah, Marie, that's right, I hardly ever go to the doctor. I never really get that sick enough to need that. And so that's great if that's you, and you don't need to seek traditional medicines or medicate. Let's say you don't need to seek the use of medications, and it's no surprise. I'm not here to talk about how the pharmaceutical companies are influencing Western medicine and all that sort of stuff. I'm sure you probably are aware of those kinds of things, but just in a general sense, what separates true Chinese medicine, or really the roots of Chinese medicine, classical Chinese medicine, from what many practitioners would do now, called TCM, which is the mishmash of all different styles of Chinese medicine, and definitely separates it from Western medicine, is that it's not an attacking system. So what that means is if you come to a practitioner, they're not going to give you medicine that specifically like herbs. Like, for instance, I've got a lot of herbs behind me here. The herbs are designed to help your body facilitate, to promote its best function, so that then your body does whatever's needed to be done. And when I say that, I know it sounds quite flippant, whatever needs to be done, but that is the brilliance and the beauty of our human body, that it actually can heal itself, and that a Chinese medicine practitioner should really believe in that. I just certainly believe in that, and most practitioners do believe that the body has the ability to heal itself. It's just what is prohibiting it, what is doing that. Now, sometimes illness is too far gone, and there's certainly like cases in earlier texts that we study, where the advice to the students learning is, hey, this case is too far gone. There's nothing really much that can be done about this here. So there's a massive emphasis on preventative treatment or early treatment. And I remember back in school learning those principles and those ideas, and then what's actually filtered into to stock standard TCM or traditional Chinese medicine is this use of it almost like a Western medicine use. So you've got an illness, and then there's this herb is antibacterial, or this herb is antiviral, and these herbs have been shown in research to help people who have MS or have this or have that pattern, have that sort of disease name. And that can be useful for TCM for sure. I'm not discounting that research and that use, but the issue is that really what Chinese medicine is? No, its system is not an attacking system. So what that means is, really challenges that belief in ourselves as we think in terms of how I was brought up and how I was just the values and the beliefs that you have about medicine. So if you're sick, you need to take something to get rid of that sickness. That's an inherent belief that what medicine is. Whereas Chinese medicine isn't really that. It's actually about, if you're sick, why isn't my body fighting this illness? Or, okay, I'm sick with a cold or a flu. That's normal. I need to give it time to fight this cold or flu. Now, not weeks and weeks with a cough isn't normal. Those kinds of things, like knowing what's normal, what's the normal course of illness, and whether you allow your body the right circumstances in order to heal itself. It makes a big difference in how you heal yourself. Do you recover on and come back to normal health, or do you come out of that illness or that situation with something worse and some sort of like chink in your armor, some sort of like deficiency there, that then your body isn't able to function. Now I see lots of patients where what happens is they'll say, 5 years ago or 3 years ago or even a few months ago I had this cold or a flu, I had this illness, and then they'll use these terms, ever since then blah 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 blah, all these other things have happened, or they had a massive trauma in their life. Now these are the things that we can't predict sometimes. They had a divorce and they had a huge tumultuous kind of issues that happened, and then ever since then my health hasn't been right, my sleep hasn't been right, these kinds of things. So in Chinese medicine we're thinking about, okay, sometimes the cause of the illness needs to be addressed. Like if you're not sleeping well, then that will lead to all these other flow-on effects, and so we kind of look at those flow-on effects, maybe to treat those as symptoms, but the cause is the person isn't sleeping, so that's the thing that needs to be addressed. What I really want to talk about here today is that Chinese medicine is not an attacking system. So that's one thing that makes it totally different to Western medicine. So if you're sick, you're ill, you're thinking about what medicine system should I use, then that is one thing to consider, that Chinese medicine treatment, especially herbal medicine treatment, takes time, because it's actually taking the time to take your body's functional ability from one place to another. So when you finish a course of treatment with a Chinese medicine practitioner like me, then you should be at a better place. Your body should be at a better place of functioning. So some of the symptoms that you had may or may not even go away. Like some symptoms may not go away. There's some symptoms that are so severe, they've been there for so long, or they may not go away, but they may get better. Like let's say you've got numbness and you've had that for years and years, that those symptoms may get a little better, but the numbness itself may not completely go away. Now we would do everything we can to address those symptoms and to make you as better as we can. But I'm just being honest, there's some symptoms that cannot, like they will never actually completely go away, because the time it's taken for the person to, they've just left it so long before they've even sought any treatment. But that's probably another story to go on with that idea. But it's this philosophy that Chinese medicine is designed to make you stronger. So whatever you've come into for treatment for, you're in your entirety, your body should actually get stronger. Your body's ability to fight illness, ability to cope with mental problems, to cope with the environment around you should get better. Your body should get stronger. For a person like me, how do we utilize such a great system? And the thing that I can offer you as a patient is that the years of training and the skill and the ability to understand what is actually being said in these ancient texts and how that applies to modern day kind of illnesses. In addition to that, what I do is I spend a lot of effort and time, invest a lot of my time into training in pulse diagnosis. So the system of herbs that I practice is specifically based on pulse diagnosis. Now, some practitioners don't utilize such a heavily pulse-based system. What that means is that the diagnostic material can come from lots of different places. A TCM or a Chinese medicine practitioner should always check your pulse. If they're not doing that, then they're probably not even practicing proper Chinese medicine, especially for herbs. So if your practitioner is checking your pulse, what you learned when you were in school, just kind of, it's been 17, 18 years since I studied. That information and the information that my teachers gave me, that kind of, you deviate away from that, you fade away from that. So in the last couple of years, I've really honed that focus in on that, and I've found a group of people that I study with who are all like-minded, and what the system is that I practice is a lineage-based system. So what that means is it's a family generational system that is taught and encouraged for all the students that are learning that or have learned that to continue to learn. So we do training days regularly. So that's why if you're a part of my practice, you'll notice that I do go away quite a lot, 3 or 4 times a year sometimes, to do more pulse training and herbs training to be able to get better, so I can bring you the best treatment that I can bring. The system, the Chinese medicine pulse diagnosis is really an amazing thing, but it's quite complicated, and it just requires a practitioner to continuously go back to that source training, so that in Actually, how it was meant to be taught is that you would, as a student, you would sit with your doctor, your teacher, your sifu or whatever, in their clinic for years and years, and they wouldn't send you out on your own until you'd been with them for years and years. Sometimes 10 years in some cases, until you're really ready to do what you meant to do. And in many cases, you'd sort of still be practicing similar to how we have our hospital system here. You'd still have that doctor to go back to, like, hey, I've got this patient that's difficult. What should I do about this? Rather than with our system, our training system is kind of like, okay, you do 4 years of training at university, and then you're pretty much just out on your own. You don't do there's no requirement for students, and there was no requirement for me, certainly, to have to do clinical training in someone else's practice. Like a GP has to do a certain amount of supervised hours, we would say. So what that means is, a supervised hours means I'll still see the patient, and the other GP may be present in the room, or they may be in the practice somewhere, or they may be on call, so that they can actually oversee and they take on some of the responsibility for what's happening to those patients. There's no requirement for that in TCM or Chinese medicine in Australia, and that's just how it is. The risk is a lot lower, obviously, for what we're doing, but then the reward is less, because if you had that supervised practice, then your patients probably would get better quicker, because you have the benefit of like someone else who's had years and years more experience than you. So rather than turning this little post into a complete rant, I would probably cut this down and make a different post, but this will be the long one that if you're listening to this is the full version here. What I can offer you is that pulse-based herbal medicine. That's what I do in my practice. So I will see patients, ask them a few questions about what's going on, check their pulse, and then maybe ask them some other questions, because sometimes we feel something in the pulse and then we need to clarify what that is. So by feel something, I mean like we feel a particular feeling, a particular shape, and what that means is that could have 2 or 3 meanings. It depends on the symptoms that they have, and certainly the formula of herbs that we use will be different according to their pulse. And really what the pulse is telling you is actually we shouldn't go into that, we'll be here forever. So it takes years of training to get the pulse diagnosis right, and then what happens in our TCM schools is then you go off and you haven't had any of that supervised practice. Now I was fortunate enough to save up money and go to China straight away, and that really made a massive difference for me. Some of my colleagues didn't do that, and they don't, and I even see this with students, they just don't have the it just changes the way you practice. Let's just say that makes you heaps better. But then what do you do after that? So do you keep going back to China and getting more training? Lots of students do that, and if you're fortunate enough to find a good teacher in China and you can do that, yeah, great. That's good if you do that. But I guess what I've found now in the last couple of years is through the system that I practice, there's ongoing training provided, and there's also access to, like, we have a mentors group. So if we have a difficult case, I can ask colleagues that have had 10, 20, 30 years practice just in this system alone, let alone all their other Chinese medicine training, and they can give input on that case. So that's what I often use that when I get difficult cases, because to be really clear, like, a lot of patients I see are very unusual cases. They may be, like, it's not that common for anyone to see those kinds of cases. So everyone's individual, and that's the benefit of Chinese medicine. There's no person we can't address within the system, and certainly with this system, there's no person you can't give a herbal formula to that would benefit them, because the system that I use, the pulse will kind of tell you what they need straight away, and you're like, what do I need now, and then in 2 weeks or a month's time, what's their body need now. And so what that's doing is that's affecting the functional system of their body. So you're basically readjusting the function, making that body stronger, and then it's up to the body to kind of do what it needs to do and to treat that illness or that kind of stuff, if you like. It's kind of like thinking in terms of an attacking system versus a functional system. Is kind of like having a plant. So you grow this plant from a seedling, it starts to grow and it's looking really good, and then you notice that pests are coming towards that plant, like there's ants or fruit flies or something like that coming up to the plant, and they're kind of going to eat the plant away. So you think, well, I better start protecting that plant against those things. So you start spraying pesticides on it all the time, and the plant's not doing very well. Maybe the bugs aren't eating it, but like there's other things that needs to be done to that plant to make it strong. Maybe it needs water, maybe it needs sunshine, maybe it needs better soil. If you don't do those things for the plant, no amount of pesticides is going to keep that plant healthy. So it's not just about attacking the things that come into our body, but we also need to make our body healthier so that it can function well. If you've got a question about your specific stuff, you're welcome to send me an email to ask me that question. That's totally fine. You can call the clinic. You can just go straight to booking an appointment if you're like, I'm in Perth, WA. So I see patients from all over the place, but you do need to come in and be seen. I cannot do Skype or remote consultations with this system of diagnosis. If you're not in Perth and you'd like to do this system of Chinese medicine, I can hook you up with a colleague who does this. There's people all around the world that do this system. So you can also send me an email, and I'm happy to forward on someone's details that might be near to you. So I really encourage you to think about the medicine that you're using, and hopefully you can understand from this video that is one big difference with Chinese medicine. It's not an attacking system. Western medicine is an attacking system. And look, in some cases, we do use both. We would encourage people to use both. In some cases, you just use one or the other. It really depends on what's going on with you. It depends on what your health problems are and your personal preference. But if you're a person that is just generally you are healthy and you want to be healthier, then this is a perfect system for you, because really there's nothing that Western medicine's going to do for you if you're just healthier. If you're just healthy and you want to be healthier, they don't really deal in that. So that is a perfect thing for this, and you can watch the other videos I have. I'll have some on prevention and more about Chinese medicine pulse diagnosis as well. So thank you so much for sticking with me in this long version of the video, and wish you all the best. I hope that you are well and that you continue to be well.